Today, I'm Adante Maria. The topic discussion is measles. Measles, also known as rabiola or the 9-day measles, it has as cold-like symptoms, followed by a distinctive rash and can be severe or fatal, particularly in vulnerable groups. It is highly contagious viral infection that spreads through airborne transmission and respiratory droplets, remaining infectious in the air or on surfaces for up to 2 hours, among the most contagious respiratory diseases, and vaccination remains the most effective means of prevention. So, what is the cause of measles or this disease? It is caused by our RNA paramyxovirus of the genus morbillivirus in the family Myxovirus viridae. It spreads through respiratory droplets and airborne particles when an infected person breathes, coughs, or sneezes, and may also spread through close contact. The virus has a reproduction number of 12 to 18. This means that one case can spread rapidly in a susceptible population. The current resurgence is linked to reduced vaccination coverage. It is due to COVID-19 vaccination, leading to vaccination hesitancy. So, what is the signs and symptoms of this disease, measles? So, firstly, incubation period. This is the period between exposure to an infection and the appearance of the first symptoms, which lasts about 7 to 21 days after exposure, an average of 11 to 12 days. Prodromal phase, or the initial early stage of an illness or condition that precedes the full manifestation of the disease, appears 10 to 14 days after exposure, and has a duration of 3 to 7 days. So, what are the symptoms? Fever and the feces, cough, coryza or runny nose, and the conjunctivitis, red eyes. So, cuff-lick spots. It is small white spots on the buccal mucosa, appears 1 to 2 days before rash and remains 1 to 2 days after onset. It is pathognomonic. The unique characteristics of measles and its presence allows for a positive diagnosis but not always present. Exanthem, or the widespread of skin rash all throughout the body. It is a erythematous maculopapular rash, flat red spot macules with raised red palms or papules, appears 2 to 4 days after fever onset. It starts on the face, at the back of your ears, neck, the trunk, arms and leg, and lastly your palms and soles. Typical duration lasts for about 5 to 6 days. And then rash fades, turns brownish, and may cause skin peeling afterwards. So the contagious window, or the most common transmission, is from 4 days before rash onset to 4 days after the rash. Complications includes diarrhea, pneumonia, otitis media, conjunctivitis, and severe complications such as pneumonitis, giant cell pneumonia, especially in immunosuppressed patients and young children, leading cause of infant mortality. And other complications are bronchitis, hepatitis, diarrhea, and thrombocytopenia. And the rhinologic complications when you have the diseased measles. Acute post-infectious encephalitis within 7 days of rash, measles, and cushion body encephalitis from 1 to 6 months later. Encephalitis affects about 1 in 1,000 children. The symptoms is high fever, about 104 Fahrenheit, headache, and severe seizures and coma. And the long-term impact after recovery, the SSPE, or the subacute sclerosing panencephalitis, fatal condition developing 7 to 10 years post-infections, especially in children infected under 5 years old. So the survivors remain at higher risk of pneumonia, malnutrition, and blindness, especially those children or adults which has vitamin A deficiency. Temporary immune amnesia leads to greater susceptibility to secondary infection for months to years. So the special populations, malnourished children, immunocompromised persons, such as those persons such as HIV and undergoing cancer treatment, and pregnant women are higher at risk, includes intrauterine growth, restriction, preterm birth, and fetal loss. Now, Kirk Saan will discuss the nutrition-related pathophysiology and the dietary management of the disease measles.
Good day, everyone. I'm Saan, and we're going to be discussing the nutrition-related pathophysiology of measles. Measles start with the respiratory droplets infecting the respiratory epithelium of the body. Then from there, it will cause localized replication, specifically in the respiratory mucosa as well as the lymphoid tissue. This would then be disseminated by the bloodstream as well as the lymph, causing now systemic infection. Now, the systemic infection would then trigger fever, thus increasing the basal metabolic rate of the body, as well as the protein and energy demands of the body. The systemic infection specifically triggers three tissue systems. First is the respiratory tract infection. This would damage the respiratory mucosa, leading to coughs, sore throat, and mouth ulcers. These three would then result in pain, as well as the anorexia or appetite loss of the patient. This would lead to inadequate oral intake of the patient. Next one is the gastrointestinal tract infection. This would damage the intestinal mucosa, causing the atrophy of the villi, increased permeability, as well as malabsorption. This would then cause or give an increased risk to develop diarrhea, um, protein loss due to enteropathy, as well as electrolyte loss, which the three of which are going to cause undernutrition. The last tissue system would be the immune system. It would cause the immune system function, or it would infect the immune system. And by infecting it, it would damage the memory type of T and B cells, which would result in immune amnesia. This immune amnesia would result in a profound but transient immunosuppression. This immunosuppression would then develop into an increased risk for secondary infections such as urine pneumonia, which causes hypoxia and increases the energy requirements of the body. The next one is the chronic diarrhea. Chronic diarrhea would then further the energy and electrolyte losses of the body, and then the encephalitis as well as the sepsis would increase the mortality risk of the patient. Next, we're going to move into the dietary management of measles. Dietary management starts with the vitamin A supplementation, increased protein energy demands, hydration and electrolyte status, as well as the antioxidant consumption, antioxidant food consumption. Starting with vitamin A supplementation, according to the WHO, it specifies the consumption of 50,000 to 200,000 international units as a supplement for improved health outcomes for measles patients. And then for dietary resources, we have um, your carrots, sweet potato, as well as the liver having the highest of them. The next one, we're going to look at the protein energy intake. Increasing, according to a article by PubMed, they stated that the body loses 1.68 grams of albumin per day, thus suggesting that we have to increase the protein requirement of the patient from to 1.5 grams to 2.0 grams of protein per kilogram body weight per day. And next is the electrolyte or hydration status. Since the patient is experiencing electrolyte loss, we have to supplement that, specifically our sodium, potassium, as well as their glucose. Alternative food sources that we can find is the coconut water. Lastly, we have antioxidant foods. Since the body experiences oxidative stress, it is better to increase the intake of antioxidant foods, which includes your guava, papaya, and your nuts. Thus, that is the dietary management practices recommended in a clinical setting for the measles patients. It includes the vitamin A supplementation, increasing protein energy demands or protein energy intake, electrolyte and hydration status of the patient, as well as the consumption of antioxidant fruits. That is all for measles. Thank you.